People in their 50s, 60s, and even 70s are lowering their blood pressure faster than anyone thought possible, using simple tools their doctors just forgot to mention. Every point your blood pressure goes up, your arteries age faster, and this gets you closer to a heart attack or a stroke, especially a stroke. That's why I'm going to show you 10 proven natural strategies to lower your blood pressure. Proven by evidence and by experience, these are the methods I use with my patients, and they help them reverse their numbers, heal their arteries, and heal their hearts. But I'm not just going to list them. We'll answer the following questions. How effective are these methods? Can they replace medications? And how do you execute them the right way? Along the way, I'll share stories from real patients who used these exact strategies to lower their blood pressure, regain their energy, and avoid prescriptions they thought they'd have to use for life. We'll change their names to protect their privacy. If high blood pressure is something you're dealing with, even slightly high, don't skip this, because by the end, you'll know exactly what's been keeping your numbers high, and more importantly, how to keep them down for good. Strategy number 1, time-restricted eating, or intermittent fasting. Let me tell you about somebody we'll call Susan. She's 61 years old, works part-time at a local library, and lives alone. For years, her blood pressure hovered around 145/90, sometimes higher. Her doctor kept offering newer prescriptions, more drugs, but she was already on 2 medications and didn't want to take a third. When Susan came to see us, she wasn't overeating, and she wasn't really sedentary either, but she did have a late-night snacking habit. She didn't think much about it. Crackers while reading, toast before bed. So we made one change. She stopped eating after 4 p.m. She kept breakfast around 8 a.m., nothing extreme, just an 8-hour eating window. Within a month, her blood pressure dropped below 135 systolic, just from that one small change. So how effective is time-restricted eating for blood pressure? It's very effective. Here's why that small change made such a big difference. When you eat matters almost as much as what you eat. Late-night meals keep your insulin levels elevated overnight. When insulin stays high, your body holds on to sodium, your blood vessels stay constricted, and your blood pressure doesn't come down like it should during sleep. But by tightening your eating window, especially earlier in the day, you give your system a real chance to reset. Insulin comes down, inflammation drops, and your arteries get the signal to relax. A new 2025 systematic review looked at this closely. It included 15 clinical trials totaling about 1,000 people who were overweight or obese. And the results were consistent. Systolic pressure dropped by over 4 points, diastolic pressure dropped around 2. It might not sound like much, but for people like Susan, who had already tried everything else, it finally gave her body a chance to respond. Not everyone needs to fast all day. This doesn't require skipping meals. But if you're eating from early morning until late at night, your body never gets a break. So here's the key question. Can intermittent fasting replace medications? In Susan's case, more intervention was needed, including some of the other strategies we'll discuss. But for people in early stages, especially those taking just one medication, intermittent fasting can be the difference between needing more prescriptions or managing naturally. And for someone not on medications at all, it can be the difference between staying off them or not. Now let's explain how to do it the right way. The simplest protocol is eating in an 8-hour window, also called a 16-8 window. That means eating between 8 a.m. and 4 p.m., then nothing after. Some people prefer eating between 12 noon and 8 p.m., and that's better than doing nothing. It's clearly better than eating from 6 a.m. to 8 p.m. But the earlier window, 8 a.m. to 4 p.m., is better. It gives your body a real chance to rest and heal without insulin in the system while you sleep. Either one gives you a 16-hour overnight fasting window. Prolonged fasting over 24 hours can really reset your metabolism, but it's hard to do and harder to maintain. If you can make it through, that's great. But what really matters is settling into an intermittent fasting pattern you can sustain every day. The most important piece is consistency. You need to do it every day of every week. These changes work better over time. Once or twice won't make a difference. It has to be a lifestyle change. Now, The 16-8 isn't the only protocol. There are other options like OMAD, 1 meal a day, or prolonged fasting. Those can also be very good, but again, you have to be able to stick with it. You're not going to fast all day, every day, week after week, but trying one prolonged fast, 1 day a week, repeated week after week, can be a game changer. These interventions do require being careful, especially about not overeating when refeeding. Now let's move to strategy number 2, a low-carbohydrate eating plan. Let me tell you about Carlos. He's 58, works in construction, and he's been battling his blood pressure for over a decade. He had already given up sugary foods like pastries and cookies, cut down on soda, and even started walking after dinner. But his numbers barely moved. By the time he came to see us, he was taking 2 medications, and his doctor had just recommended a third. Carlos had a big appetite. Sandwiches for lunch, a big plate of rice for dinner, things he thought were harmless. But we ran some deeper tests and found he was already insulin resistant, borderline diabetic. So instead of lowering sodium like the DASH diet recommends, we changed something else, something more foundational. We shifted his meals away from the starches he'd grown used to. You can eat that sandwich, but don't eat the bread. You can have the meat and vegetables, but skip the rice. It took him a little bit of time. We didn't cut everything overnight. That would have been too much of a crash. But step by step, Carlos reduced his carbs. Within a month, he was eating low-carb comfortably. It wasn't a diet for him anymore. It became the way he ate. By building meals around proteins like eggs and fish, adding healthy fats, and choosing vegetables that wouldn't spike his blood pressure, Carlos got where he needed to be. Within 4 weeks, his blood pressure dropped below 135/85. Within 4 months, he had lost nearly 20 pounds and cut his blood pressure medications in half. Most high blood pressure starts with metabolic dysfunction or prediabetes. That's so common. 90% of it isn't diagnosed by patients because it hasn't been diagnosed by their doctors. And 3/4 of doctors really don't know how to diagnose it. So what's the fastest way to reverse that metabolic disease? Stop spiking insulin all day. That's what a low-carb diet does, especially when you keep carbs under 100 grams a day. And this isn't guesswork. A 2023 randomized clinical trial looked at people just like Carlos, overweight, high blood pressure, early diabetes. They compared a very low-carb plan to the standard DASH diet, the one most doctors recommend. After 4 months, the low-carb group dropped their systolic blood pressure by nearly 10 points. The DASH group also dropped, but just over 5, half that. So can these diets replace medications? Of course they can. I've seen it happen over and over again. People avoiding medications altogether because they went on a low-carb diet and lost a few pounds. For those with early-stage hypertension and insulin resistance, it can absolutely replace medications. But it's not about cutting carbs for a week and then stopping. It's a shift in how you eat. Carlos kept the carbs off. He kept those 20 pounds off, and that's what made the difference. So how do you do it the right way? Start by dialing back the starches that sneak into every meal. White rice, sandwich bread, baked goods, even certain cereals. They add up fast. Any grain product, be very careful. And be cautious with the government's My Plate, because it still builds around carbs. The majority of people eating that way already have undiagnosed metabolic disease. Instead of building your plate around starches and grains, build it around protein, fish, chicken, eggs, and fill in with vegetables, olive oil, nuts, and seeds. Don't fear fat. It keeps you full and helps stabilize your insulin. Some people do better with strict keto, others with moderate low carb, under 75 grams a day. For years, I stayed around 100 grams a day while being physically active. More recently, I've gone lower, sometimes less than 50 grams a day, sometimes even under 30. You get used to it as you continue to change your low-carb diet. Over time, you start realizing, I don't need that rice. I don't need those crackers. You knock out more of those glycemic carbs, and what matters most is consistency. Any diet with less sugar than the standard American diet will help. Even Mediterranean or DASH diets can help, but not the way they were proposed. They assume you don't have metabolic disease. But if you assume that you do, then cutting those carbs out makes all the difference. Now let's move on to the next strategy. This one has a lot to do with key interventions to lower blood pressure. Strategy number 3, Weight loss lowers pressure. Let me introduce you to Malcolm. He's 57 and runs a hardware store in a small town. For the past decade, he'd been stuck in a frustrating loop. Every year, his blood pressure edged higher. 138, then 142, then 148, always over 92. His systolic kept climbing, and his diastolic was stuck at that 92 level. Every year, his doctor suggested cutting sodium, adding another medication, maybe trying to lose some weight. But Malcolm had already tried. He cut carbs. He went on walks. He even joined a gym once. Still, the scale didn't move, and neither did his blood pressure. So when he came to see us, we changed the conversation. Instead of pushing weight loss as the main goal, we made blood pressure the target, and we used weight as a tool to get there. It may sound different, but stay with me. Malcolm started a structured program focused on metabolic flexibility, time-restricted eating, low insulin load meals, and resistance training 3 times a week. Then we added exercise snacks in between those sessions. Simple things like one-legged step squats on the stairs or calf raises. He didn't count every calorie or obsess over the scale. But over 3 months, Malcolm dropped more than 20 pounds. And when you looked at his body composition, it was even better. Fat was replaced with muscle. His BMI came down by 3.5 points. His systolic pressure fell nearly 9 points. Diastolic dropped by more than 4, down to around 87 or 86. His morning readings were consistently under 130. He had done it. Not with more meds, not with strict or weird diets, but by changing his lifestyle, burning more calories, using his muscles, training with resistance, and keeping carbs low. A 2022 meta-analysis looked at over 3,000 adults who were overweight or obese. As the pounds came off, their blood pressure dropped. 6 points, 8 points, even 10 or more. For those who lost just a few pounds, enough to lower BMI by about 2 points, systolic pressure still dropped by over 5 points. For those who dropped BMI by 3 or more points, closer to 20 pounds, the improvements were dramatic. Systolic down more than 8, diastolic down by 4. That's not a small change. That's the kind of shift that can move someone from stage 1 hypertension back into the normal range without additional medications. And here's the key point. Weight isn't just a number, it's a signal. When you lose excess fat, especially visceral fat around the organs, you reduce inflammation, improve insulin sensitivity, and allow your arteries to relax again. Strategy number 4, cutting alcohol intake. Let me tell you about Mark. He's 58, works in real estate, and he's a friendly guy, always quick with a joke. Like a lot of folks in his circle, he had a routine. A couple glasses of wine with dinner, maybe a nightcap while catching up on emails. Normal enough. But his blood pressure told a different story. It was holding steady at 150 over 92, even on medication. When Mark came to see us, he didn't need a total lifestyle overhaul. We just asked him to track how much he was actually drinking. It turned out it was closer to 3 or 4 drinks a night, not 1 or 2. So how exactly does alcohol impact blood pressure? It's not just about extra calories or dehydration, though those matter, especially if the alcohol is beer. Alcohol hits your system in 5 different ways, and they all make your numbers go up. First, it cranks up your stress hormones, your fight or flight system. When that stays switched on, your heart pumps harder and blood vessels stay tight, raising pressure even at rest. Second, it messes with your kidneys, making you hold on to sodium and fluid, which pushes pressure higher. Third, it interferes with your liver, the same place where many blood pressure medications are processed, so meds don't work as well or they build up improperly. Fourth, drinking disrupts your routine. You miss medications, you sleep poorly, you eat worse. That's often the biggest problem. It increases appetite and lowers willpower, leading to overeating. And fifth, if you're already drinking more than 2 drinks a day, your baseline blood pressure is probably already elevated, which makes medications less effective. That's why even a small cutback, just 1 or 2 fewer drinks a day, can make a real difference. For some people, it's the turning point. For Mark, we made that one change. Cut his alcohol in half. Not quit entirely, just reduce. Within weeks, his numbers began to shift. And here's why. Alcohol raises blood pressure, especially when intake creeps above 2 drinks per day. Cutting back even 50% makes a significant impact. A large meta-analysis looked at 36 clinical trials with nearly 3,000 adults. Among those drinking more than 2 drinks a day, cutting back reduced systolic pressure by over 5 points, diastolic by nearly 4. It was especially true for heavier drinkers, 6 or more drinks a day, who made even modest reductions. For people like Mark, it was eye-opening. After cutting back, his blood pressure dropped to about 138/85. There was still room to improve, but for the first time in years, he was moving in the right direction. Strategy number 5. Let me introduce you to one of my patients. We'll call him Ray. He was 57, recently diagnosed with high blood pressure. But here's the thing. He was active, he ate decently, and he didn't drink. When I explained his numbers, he just looked at me and said, "Look, I've done everything right. I've done everything I can, or at least that I'm aware of. What else can I do?" We went over several different strategies, and one of them was surprisingly simple. Every morning, a glass of beetroot juice, about 250 milliliters. That's it. At first, Ray was skeptical, but he agreed to try it. We didn't change his medications. We didn't overhaul his routine. We just added this one habit. A month later, he came back with his home blood pressure logs. His systolic pressure had dropped 6 to 8 points without any other change, and it stayed down. Now, I know this sounds too good to be true, but the evidence is there. A 2024 meta-analysis looked at 11 clinical trials. Nothing but beetroot juice, nothing else. Specifically in people with blood pressure over 140/90. And what it found was real. A daily dose of natural nitrates, between 200 and 800 milligrams, lowered systolic pressure by more than 5 points. That's on par with what we expect from early-stage medications. But let's be clear, this isn't about skipping treatment. Some people, when they hear about natural strategies, think it's a way to avoid or replace their medications. Don't think that way. The goal is getting to the right blood pressure. Beetroot juice isn't magic. But for people like Ray, already trying, already frustrated, it gave his body a chance. It gave him the edge he needed. Here's how it works. Beets are packed with natural nitrates. Once in your body, these convert into nitric oxide, a molecule that helps your arteries relax. That means better blood flow, lower resistance, and lower pressure. And unlike some medications, there's no evidence it wears off over time. Now, it's not for everyone. If you're on blood thinners or have kidney issues, you need to check with your doctor first. You'll need closer monitoring. And one more thing, be aware of a harmless side effect. Some people notice pink urine. It can be surprising, but it's not dangerous. So if you're managing stage 1 hypertension and you want one more natural lever to pull, beetroot juice just might be the thing. Strategy number 6. Let me tell you about someone we'll call James. He's 58, owned a landscaping business, and has been waking up at 5 a.m. for as long as he can remember. His whole life was built around hard work. Tough, dependable, sharp with his tools, but not so much with his sleep. For years, he barely made it past 5.5 hours a night, sometimes less. He thought that made him disciplined and productive. He'd say, "Doc, sleep's for lazy people. It's just a waste of time." But his blood pressure told a different story, hovering around 150/95. His A1C was creeping toward diabetes, and no matter how clean he ate, the numbers weren't budging. So instead of adding another pill, we worked on his nights, his sleep, and not with pills. We started with sleep hygiene, a wind-down routine, off any screen by 9, dim the lights, a short walk after dinner, reading instead of TV or scrolling. The most critical piece? Consistency. Same bedtime every night, even on weekends. Same wake-up time every morning. That was the only change at the start. And within a month, his systolic pressure dropped almost 10 points. Why did that matter so much? Because poor sleep doesn't just make you tired for a few hours. It drives up pressure in multiple ways. Your nervous system stays stuck in overdrive. Cortisol runs high. Arteries lose flexibility. Insulin sensitivity drops. When insulin goes up, your kidneys retain sodium, and your blood pressure keeps climbing, day after day, night after night, even if you don't feel it. But when you give your body real rest, proper recalibration, everything shifts. And the research backs it up. A 2025 meta-analysis included 15 sleep intervention studies with nearly 900 people. Every single participant was struggling with poor sleep. And when they improved it, systolic pressure came down by about 5 millimeters of mercury, diastolic by 3. And when people extended their sleep by just an hour or two, the results were even stronger. Systolic dropped by over 7, diastolic by nearly 5. And here's the key. These were lifestyle changes, not medications. Simple adjustments to sleep habits. James thought poor sleep was just his normal, until he fixed it. He started sleeping until 6 a.m., and his numbers and his energy finally began to shift. So how do you actually improve sleep in a way that helps blood pressure? Go to bed and wake up at the same time every day. Increase your sleep time if you can. That's a game changer. Cut screens at least an hour before bed. Make your room dark, quiet, and cool. Keep evenings calm and predictable. Think about relaxing, not about sleeping, because if your brain is racing into the night, your pressure won't come down the way it should. If you're eating clean, exercising, and still skipping sleep, it's like driving with the brakes on. You can't undo the damage of sleep deprivation with good food or workouts. James didn't need a new prescription. He needed rest, and his body proved it. Strategy number 7. Let me introduce you to Carol. She's 65, a retired school teacher, grandmother of 4, kind, meticulous, but prone to worry. Her blood pressure wasn't dangerously high, 138/88, maybe 140/90 on a stressful day. But it hovered there year after year. She felt it too, the racing heart when she watched the news, the tightness in her chest lying in bed, wondering if she should be doing more. She didn't want another medication, but she wanted relief. So we tried something very simple, a breathing pattern called Brahmari Pranayama. Each morning before breakfast, she sat quietly and practiced. Typical breathing is about 20 breaths per minute. But with this, you aim for less than 10. Slow it down a lot. And Brahmari Pranayama adds gentle humming during the exhalation. She'd close her eyes, cover her ears, inhale over 5 seconds, then exhale more slowly over 15 seconds while humming softly. At first, it felt strange, but after a few days, she began to look forward to it. The stillness, the soft vibration of humming, the way it calmed her mind without a pill. And here's what changed. Her blood pressure began to drop, not just once, but gradually over weeks. Her heart rate slowed, her sleep improved. That constant edge of anxiety started to fade. And this isn't just anecdotal. A recent study tested Brahmari breathing on healthy volunteers, just 5 minutes of practice. Even in that short time, systolic and diastolic pressure dropped. Heart rate came down. The body's rest and repair network took over. The drop in diastolic was statistically significant, showing blood vessels relaxing, the cardiovascular system stepping out of fight or flight mode. For Carol, just 5 minutes of humming breath reminded her nervous system it was safe to relax. If your mornings feel tense or your evenings heavy, if stress lingers in your body and your numbers stay stubborn, try it, 1 breath at a time. Slow in, slower out, with a hum. Your arteries will feel it. Strategy number 8, grip strength. Mark was 56, working in IT, spending most of his day seated in front of a computer. His blood pressure had slowly climbed into the 140s/90s, though he didn't feel any different. He'd already improved his diet, and between work and family, he couldn't commit to hours at the gym. What he told me was simple. I just don't have time for another hour at the gym. So instead, we tried something that took less than 20 minutes a week, isometric hand grip training. He could do it right at his desk. Twice a week with a grip trainer, he squeezed at 30% of his maximum strength, not as hard as possible, just steady and controlled. He held each squeeze for 2 minutes, rested for 2 minutes, and repeated 4 rounds. In under 15 minutes, he was done. After a couple of months, his blood pressure dropped from 144/92 to 128/84 without changing anything else. What was happening was powerful. Static contraction, like holding a squeeze, strengthens blood vessels, improves their elasticity, and helps regulate pressure more effectively. It also reduces sympathetic drive, the constant nervous tension that pushes pressure higher. Controlled studies confirm this, showing consistent drops in both systolic and diastolic pressure with this type of training. Mark didn't need the gym. This was exercise snacking for his arteries. Small, quiet moments that made a measurable difference. Then there's Rosa, 58, a retired nurse and grandmother. At a routine checkup, her blood pressure was a 149/93. Her doctor prescribed medication, but she wanted to try another path first. Her prescription wasn't a pill, but wall squats. No equipment needed, just a wall and a timer. She began with 2 sets of 45 seconds, knees bent, back flat against the wall. It burned at first, but she grew stronger. Within 6 weeks, her blood pressure dropped to 132/84 without medication. And the science backs her up. A 2023 meta-analysis covering 270 randomized controlled trials and over 16,000 people compared every kind of exercise: cardio, strength training, intervals, stretching. All helped, but isometric training came out on top. Wall squats in particular reduced systolic pressure by over 8 points and diastolic by 4. Better than cardio, better than weights. Holding a squat engages muscles in a way that signals arteries to adapt. Over time, vascular resistance improves and nitric oxide production increases, relaxing vessels and regulating pressure more efficiently. And because it doesn't spike heart rate like cardio, it's especially valuable for people who can't tolerate intense exertion. Barry was 67, recently retired, living alone outside Atlanta. After his wife passed, the days felt longer and heavier. His motivation slipped. He stopped walking, started relying on processed meals, and at his next checkup, his blood pressure was back up to 142/92, even on 2 medications. He didn't want another pill. Instead, he did something different. He adopted a dog, an older lab mix named Gus. Quiet, steady, always nearby. That single change shifted everything. Barry began walking again, twice a day, because Gus needed it. His meals improved too. Feeding Gus reminded him to take better care of himself. Within 6 weeks, he lost 5 pounds, and his blood pressure dropped to 134/85. And this isn't just a heartwarming story. The science is there. A large meta-analysis of 26 studies with thousands of participants showed pet owners had lower resting heart rates, lower mean arterial pressure, and on average, lower systolic blood pressure by about 2 points. Even more striking, pet ownership was linked to a 19% reduction in cardiovascular death. Cat owners showed greater reductions in cardiovascular mortality, while dog owners gained more behavioral benefits like increased movement. Barry didn't need another prescription. He needed a reason to get outside, a companion by his side. Sometimes, the best medicine isn't found in a bottle. It walks beside you.